Hello viewers, today we are going to discuss about ectopic pregnancy, and we are going to define what ectopic pregnancy is, causes, signs and symptoms, prevention and treatment. An ectopic pregnancy is an implantation of a fertilized egg outside the uterine cavity. And most of this implantation usually occurs in the fallopian tube. We have different causes of ectopic pregnancy, and number one cause is the pelvic inflammatory diseases. These are diseases like gonorrhea. We'll also have chlamydia infections. Another cause is smoking. Smoking usually interferes with the motility of the fallopian tubes, which hinders the movement of the fertilized egg from the fallopian tube to the uterine cavity. Another cause is old age. Age which is above 35 years is a risk factor because it interferes with the motility of the fallopian tube, which helps the fertilized egg to move from the fallopian tube to the uterine cavity for implantation. Another cause is smoking. Smoking also interferes with the movement, the motility, the myoelectrical activity of the fallopian tube. Those are the causes, and now we have the signs and symptoms. Symptom number one is a missed period is a symptom. Symptom number two is abdominal pain. Another symptom is vaginal bleeding. You can also experience fatigue, and you can also experience breast tenderness and fullness. And prevention is that prevention number one, we can advise those pregnant women to avoid smoking, and also we can encourage pregnant women to go for checkup if they may be having any pelvic inflammatory diseases, so that they can be treated in time. We can also advise women in the reproductive age to try and get pregnant before 35 years. Then treatment, we have different types of treatment depending on whether the ectopic pregnancy is ruptured or not. But we can also know whether it is ruptured or not by using an ultrasound. In an ultrasound, we'll get that the uterine cavity is empty, but the pregnancy test is positive. Then number one treatment for the unruptured ectopic pregnancy is we use a drug called methotrexate. This methotrexate interferes with the pregnant cells. And then another treatment is through surgery. In surgery, we can have one type when the ectopic pregnancy is not ruptured. It's where the fallopian tube can be opened and then the pregnant content is removed. And then another type of surgery where now the ectopic pregnancy is ruptured is where we can remove the whole fallopian tube, which can be partial. In the partial removal of the fallopian tube, it's where we can remove one of the fallopian tube because there are two. But in total removal of the fallopian tube, it's where now maybe after removing one, the other one is still bleeding. Now the doctor is forced to remove both the fallopian tubes. Thank you, Viva.